Hi, this is Occupational Therapy with Kim and Jen, and I am Kim.
And I am Jen.
And today we are going to talk to you about head banging. Several people have asked us to address this, and Jen and I have seen a lot of head banging in our 30, 40 years of being OTs. Want you to relax a little bit with it, because up to 20% of kids head bang. Kids between the ages of about 8 months to 4 years old, it's not abnormal. Lots of kids do it. Most of the time they don't get hurt. So you can relax a little bit with that. If you are concerned that they hit their head so hard, please take a video of that and show your pediatrician. Most of the time it's just something that will go away as they mature and they turn 4. If you do notice the head banging occurs with other delays that you're concerned about, for example, if they're not crawling by 10, 11 months, they're not walking by 15 months, they're not attempting to communicate with you non-verbally by, I'd say, 16, 17 months, then you can call your early intervention practice in your state. You can find that number, go to early intervention on the CDC website. Your state will pull up. You could call them. They could have a therapist call you and get an evaluation process in motion if you're concerned about other things. But we see head banging a lot. And what is it? Sometimes it's rocking a lot before they fall asleep, and they're sort of hitting their foreheads into their mattresses or hitting their heads on the back of the crib. It can be getting angry and hitting their heads really hard forward when they're mad, and then they get relief and they seem fine. Sometimes they fall backwards and hit their head for the same purpose. They do it out of frustration. Sometimes they're hitting their heads with their hands. So that is all head banging. Anything else on that, Jen?
No, just that there's pay attention to the time and the situation and why they're doing it. I've had some kids who will bang their head, realize that it hurts, and then move to a softer floor covering. So I know we've said this a lot for other videos, but take some records about why they're doing it, what's the stimulation, sensory stimulation like before, what's triggering it.
That is so
motivation.
So important. You want to have at least 3 to 7 days of records. What time of day was it? Was it before a certain activity? Does it always happen when they're sleeping? So that you can provide that information to your care provider. We often see it out of frustration. A child is learning a new skill, they can't get it, and they throw their head down out of frustration. And then we see it a lot around the time that we expect them to start using words. We ask them to say something. They feel the pressure to say something, they can't do it, and they have a little meltdown and they hit their heads. So depending on which of those, whether it's communication or learning a new skill, we're going to address that a little bit differently. If they're learning a new skill, some kids are really even-tempered. They get frustrated, they fail, they'll just roll with it. Other kids, they get a little more stressed about it. And in those kids, we need to break the new skills down to steps. So if putting on pants involves 3 steps, we're only going to show them 1 step because we want that activity to be successful for them. You could also use, if you have an older child, to show them how to do that 1 step. You could also model how to handle frustration. If you're teaching them how to glue something and they can't do it, then you pretend to glue it, mess it up, go, oh, darn. Do it again, mess it up, go, oh, darn. They are watching your every move. They're learning how you handle frustration, and you want to model that for them. Jen, anything else on that?
Yeah, so I had a couple of thoughts while Kim was talking. And the first one, for the example of dressing, you want them to be successful. So don't pick the super tight shirt or the jeans or the skinny jeans that they could barely get on. Sometimes I even have them work on clothes that are not their size, that are a little bit bigger, stretchy pants, just so they're successful. So make sure that you're setting them up for success as opposed to failure. And even if they can't do all of the steps, maybe they could just step their foot into the pants. Yay, great. Or maybe you could put it over the shirt partway over their head and they can pull it down. Yay, great. Or maybe they can get the last arm in after you've put everything else on. So break it down and set them up for success and cheer the success.
Yes.
Because that's what we're looking for. We want them to be successful.
And as you were talking, I thought about something with the kids that are frustrated when learning new techniques, label that behavior. If they're frustrated, say, oh, that is so frustrating. It's so hard when you can't do that. So that eventually they're going to be able to put words to their emotions, because right now they can't. They're too young. So they act out their frustrations. That's why they're hitting their head, because they can't tell you how frustrated they are. So label them as well. Kids also get very frustrated around the time it's time to communicate, because everybody wants our children to start talking at 18 months. And not all children do. It doesn't mean that they're going to be delayed. It's harder for some kids than others. But when we put that expectation on to say, we say to them, say shoo, say shoo. Well, I feel like if they could say shoo, they would. And us asking them over and over again is going to put some stress on them. And kids that sometimes are stressed will hit their heads. So be very careful when it comes time to communication, that we have realistic expectations. And if they're not saying it, they would if they could. Just give them a little bit more time. Anything else on the communication piece, Jen?
Yeah, so my idea with that, with communication, maybe we could, depending on the age of your child or the level of your child, maybe we could give pictures, or maybe we could hand 2 shirts. Which shirt do you want to wear? So that they're communicating and making choices that way. But for the example that Kim said, let's say we had a cup and a shoe, and we wanted them to say shoe or tell me which is the shoe. If you put it like a little more forward, so that's the one that they gravitate towards, you're right, you picked the shoe, good for you. Because they might not be able to say the word, but they might know the word or know what you're asking them. And again, we just want to set them up for success.
Right. And if they're not coming out with words, we as therapists really want them to communicate, but it doesn't have to be with words. It can be with gestures. It can be with pointing. Jen said it can be making choices. That's really, really important. So don't get hung up on the words. Now, again, if you're concerned that they're delayed and they're 24 months and they're not saying anything, then contact your early intervention site. The second time that we see lots of head banging is at nighttime. Kids often do it as a way to sort of rock themselves to sleep. They were in their mom for 9 months. They were used to being rocked, and they're doing that sort of to self-soothe. It's only a problem if you feel like they're going to hurt their heads. You can substitute it with other things. You could give them a little rocking chair and see if they'll rock before they go to bed. You could get a large Pilates ball, see if they'll rock over the Pilates ball. If you're really concerned and they're over the age of the SIDS concern, and you can ask the pediatrician about this, you could pad the crib so they don't hurt themselves. I've had other families that will put their children in pack and plays to sleep, because it doesn't have that hardwood surface around it. Other families will put their child in a toddler bed a little earlier than they would. They move it away from the wall. They have a soft headboard. So those are some of the things that you can do around sleeping. Jen, any thoughts on that one?
Same with the vestibular, the swinging is super important. So if you don't have a swing that hangs down, maybe you could do a blanket swing, or maybe you could even rock them in your arms, have them in a rocking chair. And the other piece of that, and we've also said this before in our sleep video, is cut back on that TV time, especially when it's as related to sleep, because it kind of, that blue light kind of messes, TV and technology, messes up with the internal melatonin that we're trying to produce. So sometimes kids are overtired or undertired, and it may cause them to bang their head a little bit more.
That's a really good point. Number 3, we often see kids banging their heads, and it could be a sensory reason. I don't know if that is a new topic to you. We have lots of videos on sensory issues on occupational therapy with Kim and Jen, but we see sensory issues in about 5 to 15% of our kids. They could be sensory seekers, meaning during the day they're running all over the place, they're jumping on the couch, you can't get them to sit still, so at night they're moving. Just like they move all day, they're moving at night. I'm going to attach a video to this one on what to do about sensory seekers, but just to throw in a couple things, if you think they're doing it because they need that extra sensory input, you can give them that extra sensory input through the day or before they go to bed. Maybe they're out on the playground before you put them down, because climbing and walking and running and jumping, all of that is a sensory input that sensory seekers are craving. And a lot of times just rhythmic head banging is a form of sensory seeking. So we want to give it to them in other ways. Sometimes they're sensory avoiders, and you had them at the grocery store and it's too loud and there's too many sights, and they hit their head for a quick relief. So sometimes hitting their head is a way to relieve themselves of something that's stressful, particularly from a sensory perspective. If that happens, that's where Jen was talking about, you keep a log, you write down when it is happening, and you might start to see a pattern that it happens every time you go to the grocery store, or it happens every time that you go to a party and it's very loud. And that's when you definitely want to call your early intervention group and maybe get an occupational therapist on board to see if there's some sensory sensitivities going on there. And anything else on sensory?
Well, I was just thinking about the understimulated child. So I've talked to some parents who the kids during the week, their life is very rich. Either they're going to ABA or play project or school or a friend's house or a daycare, and they are super busy, and they come home on the weekend and it is not the same. So they could be a little understimulated. So just make sure you look at some of those videos for the heavy work, and make sure that we give them the input that they're craving. So they're crying during the day might be more related to the fact that they're looking for stimulation, and then it might come out as head banging.
Yeah, exactly. Number 4 is behavioral. Some kids really do it to try and manipulate their parents. And those are the kids that you know that they do it, they're trying to manipulate you when they're looking at you right before they do it. In those situations, and only in those situations, I ignore it. I don't want to reward them with my attention if they're doing it to manipulate me. I'm not going to give them what they want. I will make sure they're in a safe place and they're not going to hurt themselves. But if they're trying to manipulate me because they didn't get what they wanted, or they're trying to get something, I'm going to ignore that. Now, you also have some behavioral kids who do it because they're angry. They're not trying to manipulate you. They don't have the coping strategies to handle their anger, and they get relief from that anger, that stress, and they hit their head. I'm not going to ignore that. I'm going to try and teach them some appropriate coping strategies. So those are the kids I might walk over and slap them on the floor and go, "You are so mad." And they stop what they're doing. They're kind of startled and they look at me like, "That's right, I am mad." And then they stop. So those kids, you want to come up with some other tools to help them work through their anger. Thoughts on that one, Jen?
So it's always a fine line, and sometimes you never know if it is behavior or not behavior, and sometimes it could turn into behavior depending on if they get enough attention for it. So again, I know we're beating a dead horse, but take your data. I had a family who sent me a video, and I watched the video, and the child was banging his head on mom's leg. Someone came into the room, an older sibling, and the child stopped immediately. So in my opinion, at that time, it was fear behavior, that he was just looking for attention. And I don't know whether he knew that mom was videotaping, but watch the motivational piece of what's the reason behind what the child is doing. But always and forever make sure that they're safe. I mean, that is our number 1.
Right, exactly. Number 5 is pain. Little kids can't tell you that they have a headache. Little kids can't tell you that their allergies are bothering them, or they have an ear infection, or they have teeth coming in back here and they hurt. And sometimes the only way they handle that is by hitting their heads. So these are the kids, that's why helping and documenting, what's going on. If you don't see any of these other patterns, but your child has a runny nose, or they're grabbing their ear a whole lot, or they're drooling a whole lot because they're teething, those could be the reasons for it. They can't tell you they have a tummy ache. So you definitely want to keep in contact with your pediatrician when you do have a head banger, just to make sure that nothing else is going on with them. And number 6, Jen, was the anxiety.
But let me go back to the pain for one hot second. So I've had some kids who have had gut pain and weren't able to verbalize that or communicate that, and they only figured it out by going to the doctor and getting like a full workup. So it wasn't even related to inflammation around the head. It was in the gut, and who knew that that's the way that they were trying to tell us that they were really in pain. So it doesn't have to necessarily be pain in the gut. But the last one that I see is also anxiety, that there are kids that they might have anxiety about going out in a crowd, or going to a birthday party, or going to school, and they use their head banging as just a way to communicate that they're anxious, and they don't have the words for that.
Right. Yeah, it's definitely sometimes a substitute for words that they don't have yet. So we hope that this was helpful, and please like and subscribe and put your comments in the bottom. Thank you.